Okay, again clinically anti-arrhythmic can be classified into arrhythmia types of arrhythmia. Arrhythmia clinically can be classified into, or drug used in the arrhythmia clinically can be classified into different, like those drugs which are used in the supraventricular arrhythmia, drug which are used in the treatment of supraventricular arrhythmia, for example these adenosine, verapamil and diltiazem. Now drug used in the ventricular as well as supraventricular arrhythmia, examples याद रखो amiodarone, beta blockers, disopyramide, quinidine and procainamide. Now drug used in the ventricular arrhythmia, lignocaine, mexiletine and bretylium tocilin. Now drug used to treat the paroxysmal ventricular tachycardia. Question as it is asked is, so adenosine. Adenosine is a drug of choice in the treatment of paroxysmal supraventricular tachycardia. For drug used in the AV block, isoprenylene. Now there are certain drugs which can produce arrhythmia. जो arrhythmia drug का adverse effect होता है, कौन से drug है ऐसे arrhythmia करेंगे. So classes and examples of drug which prolongs the QT interval and causes torsionary day points. That means they causes the arrhythmia. That's ये as it is याद रखो. There are certain drug which produces the torsionary day point. So drugs like anti-arrhythmic. आप बोलेंगे सर एंटी एरिथमिक ड्रग क्या किससे करेंगे, वो तो एरिथमिया में यूज करते हैं, वो ही खुद ही पैदा करते हैं कि यस every anti-arrhythmic drug can produce arrhythmia because they are depressing your heart. So anti-arrhythmic like quinidine, procainamide, disopyramide, propafenone and amiodarone. So remember class 1A anti-arrhythmic drug जो है, every class 1A anti-arrhythmic drug has a torsade day points as adverse. Then potassium channel blocker, amiodarone, will also have a torsade day points. Then anti-malarial drug like your quinine, mefloquine, artemisinin, halofantrine, gadifloxacin, sparfloxacin, antibiotic like DNA kinase inhibitor, they prolong the QT interval, causes torsade day points or arrhythmia. Antihistaminic drug like terfenadine, then your estimizole and ibastine, they causes the torsade. Antidepressant drug like amitriptyline and other antidepressants, they also cause torsade points. Antipsychotic drug like thyroidazine and desperidone causes. Prokinetic drug like cisapride also causes torsade point. उसके बारे में उस टाइम पे भी देखा था अपन when we were discussing the anti-serotonin drug or 5-HT blockers. At that time I have told you. Now you can see over here details of pharmacology of each class. Now first, what will be the action of class first A drug? Class 1A drug जो है जैसे क्विनिडीन, डिसोपाइरामाइड वगैरह, वो क्या करेंगे? They will decrease the slope of this phase 0 depolarization. Normal जो depolarization होता है ये ऐसे होता है. So they will decrease the slope. In presence of this drug, they will decrease the slope of this phase 0 depolarization and will prolong the effective refractory period. So class 1 drug, they slows down, they decreases the slope of phase 0 and prolong the effective refractory period. Now class first B जो है, they also decreases the slope of phase 0 depolarization, but they decreases the action potential duration. So action potential duration को decrease करेंगे. phase ये जो class first वाले है वो phase इसका slope decrease भी करते हैं, लेकिन action potential duration क्या करते हैं? बढ़ाते हैं. phase second class 1B क्या करते हैं? जो उसका slope है वो decrease करते हैं और action potential duration कम करते हैं, decreases the action. Then class 1C drug, that is a potassium channel blocker. What they will do? They will decrease the slope of that phase 0, okay? And they will not have effect on action potential duration. Class 1C drug will not have action potential duration effect. तो क्लास 1A ड्रग जो है वो क्या करेंगे? फेज 0 जो है डीपोलराइजेशन का स्लोप कम करेंगे, प्लस क्या करेंगे? एक्शन पोटेंशियल ड्यूरेशन इंक्रीज करेंगे. क्लास सेकंड जो ड्रग है क्लास 1B जो है, क्लास 1B वो क्या करेंगे? वो फेज 0 का स्लोप जो है वो कम करेंगे एंड दे विल डिक्रीज द एक्शन पोटेंशियल ड्यूरेशन. देखो क्लास फर्स्ट ए स्लोप को कम करेंगे, एक्शन पोटेंशियल ड्यूरेशन को इंक्रीज करेंगे. क्लास सेकंड वाले स्लोप को कम करेंगे, एक्शन पोटेंशियल ड्यूरेशन को डिक्रीज करेंगे. ठीक है. क्लास 1C वाले क्या करेंगे? स्लोप को डिक्रीज करेंगे and they will not have any effect on action potential duration. So that's how there is a mechanism of action of all drug. Now first one is a your quinidine class 1A. So it causes inhibition of sodium entry in the phase 0 of depolarization. So it will prevent the entry of sodium into the cell. The sodium channel blocker, sodium ion channel blocker, your quinidine. So it causes the inhibition of entry into phase 0 of the fast response of cardiac action potential, which leads to slow down the entry of sodium into phase 0, which leads to masking of phase 0, making the phase 0 slanted. मतलब ये phase 0 को ये स्लोप क्या करेगा, कम करेगा. ये देखो यहाँ पे एकदम स्ट्रेट है, ये स्लोप ज़्यादा है, यहाँ पे क्या है, स्लोप कम है. So it makes phase 0 slanted, means decreases the slope. And slight prolongation of action potential duration, मैंने बोला slight prolongation of action potential delays the responsiveness and conductivity. Atrioventricular conduction हो रहा है, impulse वो कम करेगा. Decreases the refractory period, sorry increases the refractory period. तो जो टोटल पीरियड होता है इसके बीच में कोई इम्पल्स नहीं बनेगा तो उसको इंक्रीज करेगा, रिफ्रैक्टिव पीरियड उसको इंक्रीज करेगा. And it also prevent the re-entry of immature impulse, and it is indicated it is used as a broad spectrum anti-arrhythmic drug, quinidine. But this quinidine has a lot of adverse effect, and that's why it is no more used. And instead of that, another drug is known as a adenosine, that is also known as a broad spectrum anti-arrhythmic. So we'll see the details regarding your quinidine. So quinidine is the प्रोटोटाइप ऑफ क्लास फर्स्ट ए. तो डिसोपायरामाइड ये उनका डिटेल में नहीं देखेंगे, सिर्फ क्विनिडीन का देखेंगे. क्विनिडीन इज अ प्रोटोटाइप ऑफ क्लास 1 ए. कार्डियक एक्शन क्या है इसके? So they are mainly due to vagolytic and myocardial depression property. It is an anticholinergic, it is a vagolytic, and it is a myocardial depression. It gets bound to cardiac cell muscle and blocks the sodium ion channel and modifies the various electrophysiological properties of cardiac tissue. It also inhibits the potassium ion channel. We have seen that. Now, what is the effect on automaticity of cardiac muscle? So obviously, it will decrease the automaticity. It will decrease the automaticity in the cardiac tissue, and particularly the ectopic foci. जो ectopic foci बनते हैं, जो नॉर्मली ऐसे नोड जनरेट करता है इम्पल्स, और जो एरिथमिया होता है उसमें दूसरे सेल जो है कार्डियक सेल उसको भी कैपेसिटी आ जाता है कि इम्पल्स जनरेट करे. सो इफ अदर सेल जनरेट्स इम्पल्स, दैट इज नोन एज ectopic foci. Okay, ectopic foci. That ectopic foci generates the impulse, and because of that impulse, there is arrhythmia. Automaticity of heart is decreased or depressed. That means ectopic foci will not become active, and there will be prevention of arrhythmia. It is depressed because of diastolic depolarization. Now, excitability of heart is also depressed. Depresses the excitability of cardiac tissue, and a weak ectopic impulse therefore becomes ineffective. Conduction velocity क्या है? It will slow down the conduction velocity in the cardiac tissue, and this property along with the increased refractive period also contribute the anti-arrhythmic activity of this quinidine. Now refractory period के ऊपर क्या है? Blocks the delayed rectified potassium channel and prolongs the repolarization by direction. However, vagolytic action of this quinidine result increases the arterial refractory period, but this in the ventricles are unaffected. Overall action of this is a prolongation of refractory period in atria and decrease in the AV conduction. So that's how that is action on cardiac muscles. So decrease in the automaticity, decreases the excitability, decreases the conduction velocity, prolongs the refractive period. What is the action on AV conduction? Atrioventricular conduction. So again depression of AV conduction, predominantly in the atria and Purkinje fiber because of the vagolytic action and enhancement of conduction at a AV node. Quinidine is contraindicated in presence of ventricular conduction. Contraindicated in presence of intraventricular conduction disturbance. Now contractility, heart के contractility के ऊपर क्या action है? So it has a negative inotropic action on heart, decrease the force of contraction. That is a disadvantage. And actions are reduced in the hyperkalemia. अगर पोटेशियम लेवल ज़्यादा बढ़ जाता है तो उसका एक्शन कम हो जाएगा. Increased in the serum potassium increased serum potassium enhances the depressive effect of quinidine. अगर पोटेशियम लेवल बढ़ गया आपके बॉडी में तो उसमें इसका एक्शन ज़्यादा बढ़ेगा. It will depress the heart more. So depressive action of quinidine is again enhanced by increased potassium. नाउ इफेक्ट ऑन ईसीजी, ईसीजी के ऊपर क्या इफेक्ट है जब आप ईसीजी निकालोगे तो increase the QT interval, depression of EST wave, widening of QRS complex, intracanal bradycardia, ventricular fibrillation may be precipitated because of the increased refractive period and decrease in the conduction velocity. अब एक्स्ट्रा कार्डियक एक्शन क्या है? ब्लड प्रेशर के ऊपर क्या है? तो ऑब्वियसली डिप्रेस करता है हार्ट को, तो क्या करेगा? ब्लड प्रेशर डाउन करेगा, सिग्निफिकेंट लोअरिंग ऑफ ब्लड प्रेशर. मिसलेनियस एक्शन क्या है? मिसलेनियस एक्शन है स्केलेटल मसल पे, depresses the skeletal muscle, okay, and also it has an anti-malarial action and oxytocic action. Oxytocic मतलब it will contract the uterine, pregnant uterus जो है उसको contract करेगा and abortion करेगा, so it is oxytocic. Absorption, distribution, metabolism, elimination, it is completely absorbed from the GIT. Around 70 or 90% drug is bound to plasma protein, metabolized in the liver, and it has a drug-drug interaction. जो एंजाइम इंडक्शन है, इंड्यूसर है, वो मेटाबॉलिज्म जल्दी करेगा, जो एंजाइम इनहिबिटर है उसका मेटाबॉलिज्म कम करेगा. नाउ विल सी द नेक्स्ट पॉइंट. सो एडवर्स रिएक्शन क्या है इसके? देखो, सो कार्डियक टॉक्सिटी. एडवर्स रिएक्शन क्या है? कार्डियक टॉक्सिटी. सो इट कॉजेज द ब्रैडीकार्डिया, कंडक्शन डिफेक्ट, it causes the heart failure, okay, it can produce torsade day points. Every class 1 drug can produce torsade day points. It can produce ventricular tachycardia and hypertension. Drug can prolong the QT interval. This drug can prolong the QT interval and can precipitate polymorphic ventricular tachycardia known as a torsade day points. It may result in the syncope and death. तो ये dangerous drug है. तो ये torsade day point बनाता है. Other drugs, examples of other drug which can produce torsade day points: amidaron, amitriptyline sulfide, आपने देखा है last year. Another adverse effect is embolic phenomena. So ये क्या करता है कि आपका जो है arrhythmia है आपके यहाँ, sudden restoration of sinus rhythm, sudden correction of arrhythmia, okay, sudden correction of arrhythmia by quinidine or sudden restoration of sinus rhythm by quinidine in the patient with chronic arterial fibrillation, जिसका आर्टेरिया मोर देन 180 300 इससे बीट कर रहा है, उसमें सडन नॉर्मल लेवल लाना, सडन नॉर्मल करना उसको. so what happens, that may dislodge the mural thrombi. so due to higher rate of arterial contraction, there is a development of thrombus, clotting develop होता है वहाँ पे arteria में, and sudden restoration of this sinus rhythm causes dislodge of that thrombi and from auricular appendages. This might precipitate the embolic occlusion in the vessels of vital organ. तो वो जो माइन्यूट क्लॉट है वो दूसरे ऑर्गन्स में जा सकता है एंड उसको ब्लड फ्लो कर सकता है बंद. दैट मे कॉज इवन डेथ. अगर ब्रेन में चला गया तो डेथ हो सकता है. दैट इज द इम्बोलिक फिनोमेना व्हिच इज द एडवर्स इफेक्ट ऑफ योर क्विनिडीन. क्विनिडीन का एडवर्स इफेक्ट याद रखो, टॉर्सरी डे पॉइंट्स, prolongation of QT intervals may produce this torsade day point, syncope and death and embolic phenomena. GIT में क्या करेगा? nausea, vomiting, diarrhea करेगा. cerebrum में क्या करेगा? due to hypotension, headache, dizziness and convulsion करेगा. synchronism क्या है? due to cumulative effect. जैसे ये बॉडी में ज़्यादा अमाउंट में जाएगा, it will cause synchronism. okay, quinine chloroquine भी करता है synchronism. quinine, quinidine, synchronism, everything causes synchronism. okay, so they damage the cranial nerve causing hearing impairment. okay, hearing impairment, ringing in ears, vertigo मतलब चक्कर आना, blood vision, headlessness मतलब आपके वो सर है या नहीं ये भूल जाना, tremors, and because of vascularity action it can cause dryness of mouth. okay, now drug interaction क्या है? now this quinidine is metabolized by CYP4, and those drug which increases the metabolism, which induces the enzymes, they can have interaction with this drug. Again, remember this quinidine decreases renal clearance of digoxin. तो बॉडी में से डिगोक्सिन बाहर जाने का रास्ता बंद करेगा, तो डिगोक्सिन लेवल बढ़ जाएगा बॉडी में, तो it decreases the renal clearance of digoxin and biliary clearance of digitoxin. So that means it increases the toxicity of cardiac glycogens. Then what is the therapeutic uses of this quinidine? It is used in the arterial fibrillation, arterial flutter, paroxysmal arterial and nodal tachycardia, ventricular tachycardia, arterial nodal and ventricular premature fits. So contraindication क्या है इसके? QT prolongation. If patient is having QT, Q anti-wave prolongation in the ECG, so it is quinidine is not used. In a history of quinidine intolerance, tachycardia associated with the Stokes-Adams syndrome. अगर ये है उसमें तो उसमें को भी नहीं यूज करना है. माइस्थेनिया ग्रेविस का पेशेंट है तो उसमें भी यूज नहीं करना है. These are the contraindications you have to remember. Now next drug is a procanamide. Procanamide is nothing but the जैसे लोकल एनेस्थेटिक ड्रग होता है एक प्रोकेन, उसका डेरिवेटिव है प्रोकेनामाइड. इट इज इफेक्टिव ओरली, इंट्रामस्कुलरली एंड इंटरवेनसली. Okay, pharmacological actions and hemodynamic actions are similar to quinidine. Adverse reaction याद रखो इसके. So it includes intolerance, cardiotoxicity, mental symptoms like psychosis, agranulocytosis, systemic lupus erythematosus. It can cause torsade day points again. It is metabolized by acetylation reaction in the liver to produce N-acetyl procanamide, which is having potassium channel blocking activity. Active metabolite कौन सा है? N-acetyl procanamide. So procanamide is substitute for quinidine because quinidine is having lot of adverse effect. So quinidine की बजाय ये procanamide use करते हैं कि procanamide has a less adverse effect than quinidine. Okay, it is a substitute for quinidine. और adverse effect क्या है? Main adverse effect ये lupus erythematosus and can cause torsade day points. बाकी cardiac toxicity है. Now again next drug is a class 1A disopyramide. So it has a membrane depressant effect on the heart like quinidine, but it is better tolerated. It has a vagolytic action and because of that dryness of mouth is the main adverse effect. Again along with the dryness of mouth causes urinary retention and constipation. So it is the most favored drug from class 1A. Most favored drug from class 1A for treatment of ventricular arrhythmia. Okay, it is contraindicated in presence of acute pulmonary edema and it should be cautiously used in the patient with glaucoma. Disopyramide. Our next class is nothing but the class 1B. Okay, in that you have lignocaine. Lignocaine is again local anesthetic. It is a membrane stabilizer. So selectively binds with the ischemic myocardium and does not affect the significantly electrophysiological function of AC and AV node. It depresses the diastolic depolarization and automaticity of heart muscle, ventricular tissue, shortens the ventricular action potential, has no hemodynamic adverse effect, and has low influence on conducting system of normal tissue. Toxicity is less as compared to class 1A drug. Okay, so remember इसके ऊपर कम से कम 3-4 बार क्वेश्चन आया, ये पूरा जो बोर्ड में लिखा है उसके ऊपर. So it is a first line or it is a first drug of choice for treating the severe form of ventricular arrhythmia of many etiologies. Then severe form of ventricular arrhythmia को treat करना है तो आपको first line drug कौन सा है? Lignocaine or lidocaine. Again, it is a drug of choice in the emergency termination of ventricular tachycardia. Okay, emergency termination of ventricular tachycardia. So it is a drug of choice. Again, it is a very popular drug in the ICU. Remember, very popular drug in the ICU. Anti-arrhythmic drug, popular anti-arrhythmic drug in the ICU. Drug of choice in the digitalis induced ventricular tachycardia. Drug of choice in the digitalis induced ventricular tachycardia. तो इसका यूज देखो, यूज बहुत ज़्यादा इंपॉर्टेंट है, क्वेश्चन आएगा इसके ऊपर. Once again एक बार और एक यूज देख लो. It is a local anesthetic. It will also depress the myocardial. It will also depress the cardiac muscle, but only arrhythmic muscle. It will decrease only in case of cardiac arrhythmia. Arrhythmia है तो तब उसको डिप्रेस करेगा, बाकी टाइम पे कुछ नहीं करेगा. It is a first line drug of choice for treatment of severe ventricular arrhythmia of many etiologies. Drug of choice in the emergency termination of ventricular tachycardia. Is a very popular drug, anti-arrhythmic drug in the ICU. Drug of choice in the digitalis induced ventricular arrhythmia. Okay, याद रखो. Mexiladine and procanide are the lignocaine analog. मतलब lignocaine जैसे ही वो ड्रग है. Mexiladine and procanide. Procanide has a serious dose related neurological. Procanide को neurological adverse effect. Now you can see over here the mechanism of action of your lignocaine. So it will decrease or it will slow down the entry of sodium ion inside the cell, cardiac cell, phase 0. Short, it will decrease the phase 3 of cardiac muscle contraction. Phase 3 जो है उसको slow down करेगा. It will shorten the phase 3 of cardiac muscle contraction. Reduction in the phase 3 duration जो है उसको भी decrease करेगा. Reduction in the action potential duration of ventricular myocardium. Quickening of conductivity in the retrograde conduction, जहाँ पे वो सर्कस मूवमेंट होता है री एंट्री टाइप, उसको पीक करेगा, मतलब क्विकनिंग ऑफ कंडक्टिविटी सो दैट सर्कस impulse will not get in. Then a reaching of retrograde impulse in the ischemic area when it will be in a stage of non-conductivity, becoming the retrograde conduction in extreme to be no re-entry phenomena because of that. Prevention or abolition of re-entry type of impulse that leads to abolition of ectopic focus ventricular arrhythmia disappears. That's how lignocaine will. Next drug is a phenytoin sodium. So it is an anti-epileptic drug actually, but it has a membrane stabilizing effect. It is a sodium channel blocker again. But it does not causes conduction velocity problem. It does not decreases the conduction velocity in the ventricular fiber. It also accelerates the AV conduction, reduces the duration of action potential. Reduces the duration of action potential. It is mainly used to terminate the digitally induced cardiac arrhythmia. Phenytoin. Anti-epileptic drug है, sodium channel blocker है, membrane stabilizing effect है. Next is the flecainide, one class 1C. Flecainide class 1C. Flecainide is a class 1C. Flecainide is a fluorinated analog of procainide. Procainide जो है, procainide, procainamide जो है, उसका fluorinated derivative है. Procainamide का fluorinated derivative. That is a flecainide. Fle मतलब fluorine, canide मतलब procainamide. So fluorinated derivative of flecainide, fluorinated derivative of procainamide has a moderate negative inotropic effect. मतलब ये force of contraction कम करेगा. It is used as a quinidine substitute. They can cause ventricular premature beat and can promote the incidental ventricular tachycardia. May be difficult to do. Flecainide is drug used for acute Wolff-Parkinson-White syndrome. तो इसके बारे में इसका यूज याद रखो. Flecainide is used in the treatment of acute symptom of Wolff-Parkinson-White syndrome. तो ये क्या होता है Wolff-Parkinson-White syndrome? तो ऐसा होता है कि जेनेटिक डिसीज है ये, जिसमें कंडक्शन abnormality होता है हार्ट. It is a genetic disease where there is a abnormality in the conduction system of your heart. तो यहाँ पे सबकी तरफ से बहुत सारे ईक्टोपिक फोकाई जनरेट होते हैं. कोई भी कहाँ पे कंडक्शन इम्पल्स जनरेट कर रहा है, इम्पल्स ट्रांसमिट कर रहा है. That is known as a Wolff-Parkinson-White disease. It is a genetic disease. Okay, remember. So in that it is used, but the drug of choice in case of Wolff-Parkinson syndrome is nothing but the radio frequency ablation. Radio frequency ablation of the aberrant pathway is the treatment of choice in Wolff-Parkinson. So next one is the propafenone. Propafenone. So it is again a sodium channel blocker. It will also depress the conduction and has a beta blocking property also. So it can precipitate the congestive cardiac failure, bronchospasm. So remember, propafenone is a drug reserved for ventricular arrhythmias. Ventricular arrhythmias. Now it is a mechanism of action of your flecainide. So it inhibits the entry of sodium in the inhibition of sodium entry. It will also delay the conduction, delay the conductivity. Conduction velocity कम करेगा. That's why it causes broadening of QRS complex in the ECG. It also causes the shortening of action potential duration in the Purkinje fiber. And that's why it acts as an anti-arrhythmic. Now next one is nothing but the next class is nothing but the beta blockers. Beta adrenergic blockers. तो वो क्या करेंगे, बीटा वन जो रिसेप्टर है आपका, बीटा वन रिसेप्टर प्रेजेंट इन द हार्ट, उसको ब्लॉक करेंगे, उसका ब्लॉक करेंगे. So what is the role of beta one receptor? Stimulation of beta one receptor in the myocardium increases the automaticity and AV conduction. Okay, जैसे बीटा वन को स्टिमुलेट करेंगे तो हार्ट रेट इंक्रीज होगा, फोर्स ऑफ कंट्रैक्शन इंक्रीज होगा. So stimulation of beta 1 receptor in the myocardium leads to increase in the automaticity and increases the AV conduction. It causes shortening of refractory period. Therefore, beta blockers are used in the arrhythmia. They block the activation of ACE node. They block the activation of ACE node, and obviously, because of blockage of activation of ACE node, ectopic focus will also be blocked. Then beta adrenergic stimulation prolongs the refractiveness. Again, beta blocker also has a membrane stabilizing effect. For example, only propranolol and oxyprenolol. These two drugs will have a membrane stabilizing effect in addition to beta blocker blocking activity. They are safe. They are safe drug than class first. Beta blockers have broad spectrum of anti-arrhythmic activity. ये भी याद रखो. Now individual drug देख लेते हैं.